Hi, I'm Dr. Cynthia Gregg, and thank you for watching my video today on rejuvenation of the upper. I also want to remind everybody that we're here today until 4 o'clock, and if you want to call our office or go to our website and send in an email, we have great discounts today on products. We're offering 20% off all products, and we have great discounts on gift cards as well. And everybody who makes a purchase today gets to put their name into a raffle, and we have some fantastic prizes available on our raffles today. So I really want everybody to take advantage of today. And thank you again for coming to our very first virtual Patient Appreciation Day. So thank you everyone for listening to my presentation on rejuvenation of the upper face. And I'm going to go over some questions that have been submitted to me. So the first one I've got is a very great question, and it's Dr. Gregg. Do I have to have a brow lift at the same time that I have my upper eyelid surgery done? And if not, which one do I do first? That's a great question. So if you're sitting with me during an exam and we're looking in the mirror together and you have a low brow and I raise that for you, while you're watching, and we put your brow to a great anatomical position, but you still have skin sitting on your, really you need a brow lift and an upper blepharoplasty done. However, you can just do the brow lift. If you said to me, Dr. Gregg, I don't want to do anything to my upper eyelid right now, I just want to do my brow, that's fine. And we can do an endoscopic brow lift. And you can always come back later and do the upper eyelid surgery at a later date. However, it's really important for everyone to understand that you can't just do your upper eyelid surgery if you also have a low brow and not address the brow. Because what happens is, if somebody goes in and we clean up all the excess skin on your upper eyelid and we make your eyelid look great, but your brow is still low and we know it's low, you can't come back very quickly and redo or lift the brow to where it needs to be, because there's always a risk that we've taken away any laxity between the brow hairs and the lashes. And if I raise your brow correctly, you may not be able to close your eye very well. So it really is an issue when we're worried about dry eye and other issues that could irritate the eye. So again, if you have a low brow and upper eyelid excess skin, ideally we do them together. You can just do a brow lift by itself. You can also come back later and do the upper lid blepharoplasty. So that's something that I really spend time talking about so you understand really well all your options. So here's another great question. Second question is, do I do the same procedures on women and men? That's a good question, because there are several surgeries that we perform in facial plastic surgery that we vary the approach, whether you're female or male. So upper eyelid surgery and lower eyelid surgery are performed exactly the same for both women and for men. We would use the same incision in the eyelid crease for the upper eyelid surgery, and with the lower eyelid, I would perform the transconjunctival incision behind on the back side of the eyelid. There is a difference, though, with the brow lift incisions, and so that's why this is a great question. It's very difficult in a patient with a receding hairline or someone who's lost the hair on the top of their head to hide the incisions for an endoscopic brow lift. So in that situation, I have another procedure I can offer. It's called a transblepharoplasty brow lift, and I perform it on my male patients who have got a receding hairline. Basically what I do is I perform the upper lid blepharoplasty, and through that very same incision, I'm able to go in and do what's called a transblepharoplasty brow lift. And I'm able to give them enough of a brow lift through that same incision that it's able to meet their goals of raising their brows and cleaning up their upper eyelid at the same time. So that's an excellent question. Also want to remind everybody, again, we do have great raffle prizes today. So for anyone who calls and makes a purchase, you can also purchase products or gift cards or on our website. And also anyone today that calls gets a complimentary consultation with myself, Dr. Wu, and my skincare nurses and nurse injectors. So please feel free to call or email us. I have another great question, and that is, what is recovery like after these surgeries? So there's always swelling and bruising and a need to rest after you have surgery. I always tell my patients, even though we may be choosing to do this surgery, it's still surgery for your body, and your body needs to go through the appropriate healing process. And so let's talk about each of these. So basically a brow lift. We remove the brow lift sutures about 10 to 12 days after surgery. Because we've been working up here on the temple area, I do recommend that patients stay on a soft diet for 1 to 2 weeks, just to minimize any discomfort from up here in the temple. With the upper eyelid surgery, the sutures come out around day 6 or 7 after surgery. With the lower eyelid surgery, there are no sutures that need to come out. If we use any, the sutures dissolve on their own. But all three of these procedures, brow lift, upper eyelid surgery, and lower eyelid surgery, they all have some swelling and bruising. I think the biggest complaint after a brow lift for me is that patients have a little bit of a mild headache for a few days. And then I think after the upper or lower eyelid surgery, I think the biggest complaint I get from patients is their eyes just feel irritated, like they've got allergies. It's like an allergy season. They're not blinking normally. So we give you drops and ointment to help you get you through that period, which lasts about 7 to 10 days. We do help you, though. Our office is great at spending time with you in your preoperative visit. We will go over all the list of medications that you take and any herbal supplements that you may take that may accentuate or cause bruising and swelling postoperatively, and we get you to stop those. We also give you an herbal supplement that we give folks to kind of help mitigate any swelling or bruising and help you heal faster. We also go over all types of instructions about sleeping with your head elevated and using cold compresses and everything that we can to help you get through this recovery period the best that you possibly can. Regarding physical activity, it is so important after doing a lot of facial plastic surgery that you take time off. I do recommend at least 7 to 10 days of real rest. Maybe the second week you can start doing some work from home. We do ask that you not do any aerobic physical activity for about 2 weeks. And then I like to tell my patients, give you the third and the fourth week after surgery to slowly kind of increase your physical activity so you feel like when you've gotten a month out, you're kind of back where you were the day before surgery. And I've got one other question here, and this is another great question, and that is, what helps reduce the dark circles underneath the lower eyelids? Great question with not an easy answer. And I'll tell you why. There are multiple causes of what causes dark circles underneath the eyes. So one of them can be hyperpigmentation. You could have hyperpigmentation of the skin underneath the eye that's creating that dark circle. That's something that we would address with skincare treatments or skincare products to try to lighten you back to your normal pigment. It could also be that you've got a shadow underneath your lower eyelid because you've got fat pads bulging forward. And if I can go in with lower eyelid surgery and do some fat repositioning and preservation and re-contour that whole area between your cheek and your eyelid, that will get rid of that shadow effect. So that does help with dark circles. But if the dark circle is due to kind of a blue-gray discoloration for folks with very fair skin, and as our skin gets thinner, you start to see the vascularity underneath the skin, that's more difficult to improve. It does get a little bit better with lower eyelid surgery by repositioning the fat, but honestly, there really is no easy answer for dark circles underneath the eyes, and so I just want to make sure that people understand that, but we will work with you to make some improvement. And then I've got one other question on here, and that is, what about Botox to raise the brow? And I know Melissa earlier gave a great conversation about how Botox is wonderful for positioning the brow and giving you what we call a Botox brow lift. That's going to work when you have a mild brow droop. But at some point, Botox is not going to be able to give you the lift that you need. And at that point, you're going to need to come and we'll talk about a surgical solution. But I also want to point out that a lot of folks will get Botox across their forehead here to relax the lines and the wrinkles. But one of the consequences of that is if you've got an undiagnosed brow droop, all that's going to do is cause your brow to droop more. And so some people will come to me and say, I don't like Botox because it made my brows drop. Botox didn't make your brow drop. You already had a low brow, and Botox in the forehead just showed it to you. So it's important to go to someone who understands the benefits and the risk with Botox, Dysport, and Xeomin, and we know how to use it to give you the best result. And at some point when you come and you find out that you do have a low brow, my nurse injectors are phenomenal. They'll get me involved and we'll start talking about maybe doing some surgical options for you as well. So thank you again for attending. I appreciate everybody joining us today on our first virtual Patient Appreciation Day. We really love our patients and appreciate your loyalty and support. Thank you so much. And Keep enjoying the day. Thank you. Sorry. I just shut off the next thing.